Okay, I think it's Dr. Sharmin, right?
Yes, Dr. Irfan, I'm ready.
Okay, so this is your station. You are having, you are on inside of the, in the corridor, and this is your gate, and there is a question, 2 or 3 lines there. The scenario is given something, just saying that you are going to face some few questions from spine section. So after 1 minute, you enter into the room. So this is the wall, and you are shown so many pictures, right? So Dr. Sharmi,
Yes.
I have started. No, time is not important here. Just
All right.
try to answer the question. Could you tell me which vertebra is this?
I cannot see the screen. Can anybody see the screen?
Can't
No,
you?
I don't see any vertebra or anything.
Just,
Ah.
yeah, now it's visible.
Ah.
Yes,
Can't you?
Okay.
yes. Yes. Doctor, can you show me again, please?
Can't you see the picture?
Yes,
Yes.
I can see it.
Okay, that's great. Okay, which vertebra is this?
This is the cervical one, the atlas, inferior view.
Okay, so what is this?
This is the anterior arch with anterior tubercle.
Okay, which one is this?
This is posterior tubercle.
Right, which one is this?
This is the posterior arch.
Okay, so could you tell me what are the typical vertebra and atypical vertebra of cervical spine?
Okay, so cervical 1, that is atlas, and cervical 2, that is axis, and the 7th cervical vertebra is the atypical vertebra. And in total, we do have 7 cervical vertebra. So rest of the vertebra is the typical cervical vertebra from cervical 3, 4, 5, and 6.
Okay, so could you tell me which vertebra is this?
This is the 2nd cervical vertebra, that is axis.
So what are the identifying points of the 2nd cervical vertebra?
Okay, 2nd cervical vertebra is actually having a bony prominence that is called dens or the odontoid process. And it has a short spinous process.
Okay, so could you tell me which one is this?
This is the facet for dens or odontoid process of axis.
Okay, that's great. Okay, could you tell me, can you describe this X-ray for me?
We can see this is the X-ray of odontoid view actually. So we can see here the first cervical and 2nd cervical vertebra.
Okay, so it is closed mouth or open mouth?
It's an open mouth.
So why do you take open mouth odontoid view in X-ray?
Otherwise, we cannot see that odontoid process.
Okay, so what is this?
This is the that atlantoaxial joint.
Okay, that's great. What is this?
This is the inferior articular process of the atlas.
And this one?
This is the superior articular process of axis.
Okay, could you tell me what is this?
This is the lateral mass of axis.
Okay, that's great. Okay, now come to this picture. Okay, could you describe this picture for me?
This is the X-ray of open mouth odontoid view.
Okay.
We can see there is a.
Can't you see anything here? What is the abnormalities?
Yeah. We can see here there is a fracture in that odontoid process of the axis and some soft tissue swelling in the prevertebral space.
Okay, so how do you describe the fracture? So how do you get the fracture? There is a fracture here.
Actually, we can see this. There is alignment, inappropriate alignment between the atlas, the odontoid process of the axis and the lateral mass of the cervical one. Atlas is not not equal proportion on both sides.
And there is soft tissue edema, right? Okay, that's
Yes.
okay. Okay, so could you tell me how the intervertebral discs are formed for the posture?
Yes, there will be outer fibrocartilaginous, that annulus fibrosus, and inside there will be nucleus pulposus.
Okay, that's great. Which vertebra is this?
This is, I think, thoracic vertebra.
Is it thoracic?
This is C7, right?
Vertebra.
Okay.
Uh,
Okay, no problem.
Oh,
Please.
no, this is not C7 because we don't
Is
have
there-
any transverse. We don't have any transverse foramina, so this is not cervical,
Okay,
and we don't have
a second.
superior articular. Oh, this is not thoracic. Sorry, this is lumbar because in thoracic there will be costal facet. This is
Guys,
lumbar vertebra.
who would like to join the anatomy mock session, just raise your hand. I would get give you the chance subsequently. Please raise your hand so that I can continue with Dr. Shami. Okay, which vertebra is this, doctor?
Dr. Rifa, this is a lumbar vertebra.
Okay, so would you tell me what is the identifying point of the lumbar vertebra? Why do you think it's a lumbar vertebra?
Yes. So the vertebral body is massive, and we can see this is a kidney shape from superiorly.
Okay.
And the intervertebral foramen is triangular in shape, which is larger than thoracic vertebra but smaller than cervical vertebra. We have that long and cylindrical spinous transverse process, and the transverse process is containing that accessory process also, as well as there is two process, superior articular facet and inferior articular facet, and the superior articular facet will be directed upward posteriorly and medially, and the inferior articular facet will be directed anterolaterally, and the spinous process is short, hatchet shape, and it is like short, but it will not cross the level, vertebral body level.
So what about the vertebral foramina?
It
Regarding
is triangular in shape.
and the difference with the thoracic and the cervical vertebra about the vertebral foramina?
Yeah, it is larger than thoracic vertebra and but smaller than cervical vertebra. And thoracic, I think, triangular in shape, for oval shape, round or oval.
Okay. Okay. Okay, come to this. Could you please describe this picture for me?
Yes, this is the MRI of like lumbosacral spine.
Okay. So what is this point? What is this?
This is a cerebrospinal fluid.
Yes, that's great. What is this?
Okay, so this one actually the spinous process.
Very good. What is this?
This is that chorda equina,
Is it causal equina?
the spinal cord.
Spinal cord. So sorry. So what is this? What is this? This one?
This is called phylum terminale.
Okay. Okay, that's great. Isn't there who want to join the mock session of anatomy section? Isn't there anyone other than Dr. Shamil? No problem. We can continue with Dr. Shamil. Okay, Marfa Buble, just wait for a while. Okay, Dr. Shamil, could you describe this X-ray for me? What is this X-ray?
This is the X-ray of abdomen, showing the pelvic view also, and there we can see the lumbar. We can see the lumbar vertebra, including some part of the thoracic vertebra,
For
and we can see
suppose there is a
some
so could you tell
gastric
me
shadow.
which could you tell me? Suppose there is a fracture here. Could you tell me
Okay.
which vertebra is this? This one?
The second fourth lumbar vertebra.
So how do you calculate this is the fourth lumbar vertebra?
So I will come with the sacrum actually. From the sacrum there above, it will be lumbar 5.
Okay.
Then lumbar 2. Lumbar 4, lumbar 3. That is lumbar 3,
From
I think.
upward, the 12 rib, then subsequent.
Yes.
That's great. Okay, very good. So not needed. This picture is not okay. We have gone through this vertebra. Okay, Dr. Marufa, right? Where is she?
Yes, Baba.
Okay, okay, doctor. Could you tell me which vertebra is this?
This Cervical vertebra.
Okay, so why do you tell it as a cervical vertebra?
Bifid spinous process.
Sorry, by feet?
Bifid spinous process.
Exactly. Okay. Okay. Is the only one identifying point?
It has no transverse process.
Okay. So, any other identifying point, doctor?
Smaller body.
Okay.
Transverse foramina.
Okay. Could you tell me about the transverse foramina regarding the cervical vertebrae? What are the transverse foraminas and where they are situated? And just tell me the course of the vertebral artery with the transverse foramina.
That means
So, Dr. Tanvir Bhai, are you there, brother?
Yes, brother, I'm here.
Okay, just enlighten us. So, tell us about the vertebral artery, the course of the vertebral artery with the cervical vertebrae.
Vertebral artery.
Yes.
Okay. Vertebral artery contained in the transverse foramina inside. Okay.
Okay.
Hmm.
But,
And
that is
it starts.
the,
First course is the branch of the subclavian artery, second part, and inside the transverse foramen of the vertebral.
which vertebra? What is the first vertebra that passes through the transverse foramina of vertebral artery? The course of the vertebral artery. What is the first vertebra that?
C7.
Is it?
C7.
Is it Dr.
C6.
Sharpin?
No,
C6.
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 Yes. Cervical 6 is the first vertebra through which the vertebral artery passes through, because cervical 7 is the narrowest, the transverse foramina.
Narrowest transverse foramina.
Yes.
Yes, it will only the
Actually,
cervical vein, vertebral
Actually, I'm
vein.
sorry to say that I don't have any preparation today.
So could you tell me, Dr. Sharmin,
Accidental.
after passing all the cervical vertebrae, what is the course of the vertebral artery at the level of cervical 1?
Yeah, it will go. There is a groove in the cervical atlas. There is a groove for vertebral
Where
artery. It will go to
exactly?
the foramen magnum, and it
Okay.
will go
The
up, and
atlas,
it will take a part of cervicovilis. Yes.
where is the group is exactly situated? It
It just is in the atlas, just lateral mass, behind the lateral mass, in the superior surface. There will be for vertebral artery.
okay. Is it present in the anterior arch or posterior arch?
It will be present in the posterior arch.
Okay, that's great. Exactly this question will ask in your exam, right, doctor? Okay, so what is the first vertebra you will be able to palpate?
C7, cervical 7 vertebra. This is the vertebral prominence.
Okay, that's great. Could you tell me how would you demonstrate the cervical 7 vertebra?
Yes, first I have to go to the back of the patient. I will identify the external occipital protuberance, and I will palpate downwards along the cervical spine. The most prominent spine or vertebra, that will be the C7 spinous process.
Okay, Dr. Bubli, could you tell me why we aren't able to palpate other cervical vertebrae other than cervical 7?
Because other cervical vertebra has short spinous process.
Exactly.
Rather
Is
than
one
C7.
point and another? Other points are, you do have.
There are 3 points. Three
Yes.
points. First, it is like short bifid spinous process.
And
And another is there is knuckle ligament will passes through the bifid of the spinous process.
Very
So
good.
it is very tough ligament. We cannot feel the spinous process.
Okay, could you tell me how nuchal ligament is formed, what the continuous of the nuchal ligament, and from where it is attached to?
Knuckle ligament, I think that supraspinous or infraspinous ligament, I think it is actually from the external occipital protuberance is coming, and below down up to the C7 it will come. Then it will form the infraspinous ligament. I forgot about it. Then
No,
it will go up to
not infraspinous, supraspinous ligament, right? So it is a very thick ligament and
supraspinous.
external from the external occipital protuberance, and it is attached with in this bifid ligament. That's why this spinous process can be felt, right? So that's
Yep.
the most important point. So the examiner will basically show you this picture in your exam. You already mentioned, described the picture very properly. This one will be asked in your exam if you do have the cervical spine in your station. This one, and definitely they would like to hear this fracture and why it is fractured. You'll have to describe this picture very properly, and they will ask you some relevant questions like this way, and definitely they will ask you regarding the cervical spine, thoracic spine, and lumbar vertebrae. So is there anyone who would like to tell me regarding the uh, vertebral venous plexus? Anyone?
Should I, Dr. Rifa?
Sure.
Yes. So there is external and internal, anterior and posterior external prevertebral venous plexus, and anterior and posterior internal prevertebral venous plexus. So if I'm going to mention the location, so external anterior external prevertebral venous plexus will be like with the body of the vertebra, and and posterior external prevertebral venous plexus along with the spinous process of the vertebra, and internal anterior internal will be internal prevertebral venous plexus with in front of the dura mater, and the posterior internal prevertebral venous plexus just posterior to the dura mater.
Okay, Dr. Bubli, could you mention me what are the ligaments that attach with the odontoid process? Can you see the picture? No.
No, Bhaiya.
Okay. So tell me what are the ligaments that attach with the odontoid process? This one.
In odontoid process, there will be attachment of the alar ligament and also the transverse ligament and the cruciate ligament.
No, apical ligament.
No, these three ligaments are combinedly known as cruciate ligament, if I am not wrong, right?
Yes, Doctor.
Yeah.
Three ligaments. These three ligaments are
Transverse atlantal ligament,
and
apical odontoid ligament, and alar ligament.
exactly. These three ligaments are combinedly known as the cruciate ligament, right? Okay. What are the ligament that attached with the atlas and axis?
So there are like anterior and posterior atlantoaxial ligament and the transverse ligament. Three ligaments: anterior, posterior, atlantoaxial, and transverse ligament.
Okay. Could you tell me about the course of the spinal nerve through the intervertebral foramen, right? How many vertebra present and how many spinal nerve are present, and how is the course of this spinal nerve?
Should I, Dr. Rifa?
Yes, please continue. No problem.
So vertebra will be 32 in total, and like number as cervical 7, thoracic 12, lumbar 5, sacral 5, and coccygeal 3. And if you're talking about the spinal nerve, it will be 31 pairs. So cervical will be 8, thoracic 12, lumbar 5, sacral 5, and coccygeal 1. In total, 31 pairs.
Okay. So what is the course of the cervical 8 spinal nerve? Could you tell me?
Yes, actually all like except cervical vertebra, they are emerging above the vertebra. So there will be extra one like C8, which will be superior to thoracic 1 and below the cervical 7, that is C8. And rest like thoracic, lumbar, and sacral, they are emerging below the vertebra.
Okay, doctor, is there Dr. Kaushik here? Okay. I can't hear you, brother. I can't hear you. Is there Dr. Russell? Are you there, bro? Okay, no problem.
Yeah.
Okay, could you tell me the level of the spinal cord in newborn? And
It's about in newborn it's about lumbar 3 and 4 junction, and in adult it's about lumbar 1 and 2 junction.
So at the beginning of the life, it is between the, as you said, is exactly the most appropriate is number 3 level at birth,
Yes.
and at adult it comes into the number 1 and number 2 in between. So why this really happens? Why
Sorry,
Uh,
Dr.
adult-
the
why?
disproportionate growth of the spinal column.
Yes, yes, the disproportionate growth of the spinal column and spinal cord, right?
Spinal cord, yes.
So what is the content of the spinal canal below number 2 at adult?
It's about cerebrospinal fluid, chorda equina, phylum terminally, and also the conus medullaris.
Conus medullaris, is it?
Below number 2 is the content of this canal, I think.
Okay, Dr. Sharmin?
I think it will be chorda equina and phylum terminally.
Exactly. These are the two, right? So basically, you do have so many answers, and sometimes these answers are not wrong, I do admit. But until and unless you are saying the right answer, what is exactly written on the answer script, they won't give you the mark. So in case of MRCS exam, I have already told you that MRCS Part B exam is a stage of performance, nothing is just acting. So you may quarrel with me, you may argue with me. So this the correct answer, that's okay. But the correct answer is written what is written in your book. So always try to follow the book. You may know so many things. I have whenever I have started my MRCS Part B journey, I used to go through so many books like Bailila for the carcinoma of the stomach and so many things. So one of my colleague once noticed that, and she was just saying, why are you going through the carcinoma of the stomach? You are a urology resident. I just saying, Didi, I'm preparing myself for Part B exam. She was just laughing. Are you crazy guy, man? So I said, why? So this is a scripted station. All the questions are already out. So why would you working so hard after stomach carcinoma of the stomach? This question won't be asked in your exam. The knowledge have been asked in your Part A exam, but skill and professionalism and so many things will be asked in your exam. So always try to follow the book, what is written on your book, right? So there might be so many answers and so many questions and so many things. You may know that's true, but always try to follow the answers what are written on your exam. So, Doctor, isn't there anyone who would like to join with us so that I can ask you questions? So, if not, no worries. We do have Nahida and so many people, and Dr. Sharmin is an excellent, like a bullet. And I can assure you, if she continues her preparation like this session, she will definitely pass, inshallah. I don't know about her skill portion still, but after hearing her answer style and fluency, I can assure you, you definitely pass in your exam, inshallah, if you just continue your preparation like this way. So
Just be with us, Dr. Rifat. Actually,
yes,
we need a proper guideline. As far as I assume that Part B exam is completely practice.
yes,
As you mentioned, I didn't write the exam. That's what I'm not saying anything, because it's not about like if you are a surgeon or a specialist, it's not a specialty exam. It's
yes,
just an entrance exam. So it is a structured exam. Actually, surgeon, even who is a fresh intern, they're
yes,
going to write the exam, right? So some specific materials here, there, they are looking for how nicely we are performing, how like in knowledge part fixed things. I don't know. I have phobia about patho, to be honest. Critical, I do love to study, and anatomy part, but I don't like the patho portion.
look,
And skill part, I have seen that actually no need to make very clumsy. You need to proper, practice. You have to go with all those things, and they will notice that how nicely we're handling the patients.
you'll have to be so super. I think you'll have very fluent and very professional way. You'll have to handle the patient. And
Yes.
Rifat bhai, may I add something?
yes, yes, definitely, brother.
Speaking of fresh intern, I have passed the party exam as an intern, and this is literally my first stint with this Part B exam. So seeing Sharmin Apu perform like this, and of course Rifat Bhaya's confidence, I feel that I can do it. Like you
Yes,
guys are actually motivating me over here.
yes, definitely. We are
So
here. It's our first time, and day by day, I am also in this platform for the first time. No, I have just taken a class of orientation, and this is the officially first one. So practice to make you guys just like a bullet, like Dr. Sharmi. So could you tell
inshallah.
me what are the structures you will have to encounter during a lumbar puncture, Dr. Sharmi?
Yes, so there will be skin, subcutaneous tissue, and fat, supraspinous ligament. After that, infraspinous ligament, then the ligamentum flavum, then epidural space, and the dura mater, then arachnoid, and the subarachnoid space. So we'll collect CSF from the subarachnoid space.
Okay, so which one is the first ligament you will have to encounter, and which one is the thickest ligament?
All right, so supraspinous ligament is the first one we have to parse. Then after that, ligamentum flavum is the most toughest structure,
Okay,
toughest ligament.
okay.
Yeah.
So what is the ligament that's present in the posterior aspect of the body of the vertebra?
So that is posterior longitudinal ligament.
Okay, and anterior of the vertebra?
There will be anterior longitudinal ligament, which gives support to the intervertebral disc, right?
Exactly. So after having the lumbar puncture, you entered into the subarachnoid space and you found blood CSF. So what that indicate?
In the subarachnoid space,
Yes.
that is vertebral subarachnoid space. It will be the injury to the venous plexus.
Is it subarachnoid?
No. Sorry, I'm sorry. That is subdural is the venous, cervical vein. I'm sorry, I forgot about it.
Okay, it's your homework. Okay.
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 Yes.
So, Dr. Bublik, can you tell me what is the movement that occurs in the lumbar vertebra?
Subdural due to cerebral vein and also breathing vein.
Okay. Okay.
Yes.
We wanted to hear subarachnoid, brother. Not
Subarachnoid due to the middle cerebral artery,
exactly.
which is rupture very aneurysm.
Exactly. Subarachnoid.
Oh,
That's why I was just laughing. She was just confused. Nothing to worry about. Just this thing will happen, and after having the exam, you will just regret. I couldn't answer so many things that I have used to know. Like in my exam, the examiner asked me about the operative procedure of submandibular gland, and I used to teach this thing, and so many students previously about 1.5 years back, marsupialization, I couldn't remember this name, and after having finishing the exam, I was just, oh my god, what did I do? I couldn't memorize the answer. So this thing happens, nothing to worry about. So the pass mark is almost 70%. So so if you are able to answer so many things and almost 100%, that definitely pass marks would be 100%, right? So you'll do some mistakes, and that's why it's an exam. So nothing to worry about. Just do your best and perform your best, and you'll pass definitely. So what is the content of the epidural space? Can you tell me?
Yes. Are you asking me, Dr. Ifa?
Okay, no problem. To raise your
anyone who is participating is okay. Just you can mention my name when I.
We are just habituating, no problem.
Okay. So there will be lymphatics, and there will be that spinal nerve root, and there will be two tissue like loose connective tissue, and there will be fatty tissue, and small arteries as well as venous plexus. That is that internal venous plexus, internal vertebral venous plexus.
Okay, that's great. Dr. Tanvir, are you there? Tanvir?
Yes, yes.
Okay.
Yes.
Tell me, what is the roots of metastasis of spinal metastasis really happens? What is the roots?
Through the Batson venous plexus.
Okay, so could you tell
Especially from the Root.
Why ventral venous plexus is usually the root of spinal meniscus?
Connection between the external vertebral venous plexus and internal vertebral venous plexus with the ventral venous plexus.
The only reason or the specialty of the ventral venous plexus?
These veins are valveless.
Exactly. I was just
Yes, harmless.
for this answer. Valveless. This is the main point you will be asked in your exam. I'm just looking for Dr. Riaz Bhaiya. Are you there? Are you there, Bhaiya? Okay. Could you tell me what is the roots of metastasis, spinal metastasis? One is the ventral plexus, and another. Is there any other way? We can't hear you. We can't hear you, brother.
Mainly by arterial route.
Okay. Mainly by arterial
Hello.
route. Exactly.
Then another one made direct contact.
Yes, that's
through
basically.
direct invasion through intervertebral foramen.
Okay.
Another one is ventral plexus.
Yes. Main one is the arterial route.
Arterial venous and direct.
Yes. And one is the arterial route, then the ventral venous plexus.
Venous route and DJ.
The venous plexus. Okay. Could you tell me what is the main organ from which spinal metastasis or vertebral metastasis mainly occurs? For the main organ.
From above the thyroid gland to lungs to breast, then prostate and kidney, both kidneys.
These are the main 5 organs from where the metastasis occurs. Okay. Could you tell me why spinal metastasis occurs at the adulthood, basically after having any malignancies? Especially, I don't know whether you have noticed or not that at the adult age, only the flat bones or axial bones are involved in bony metastasis. What is the reason behind this? Can you tell me?
Sorry.
Okay, no problem. So basically, these bones, the axial bones or the flat bones, these are the hematopoietically active in adulthood. After 20 years, above 20 years, all the bones in our body are hematopoietically active. But after 20 years, only the axial bones like ribs, skulls, vertebra, sternum, hip bones, these are the main bones who are hematopoietically active. So at adulthood, that's why if any malignancy occurs and if they are substituted to involve the bones, then definitely the metastasis occurs in these flat bones where hematopoiesis occurs, right? Just try to remember this one.
Okay.
So, what are the structures you will find at cervical 6 level?
Cervical 6 level. Okay. Here's a beginning of trachea from larynx and beginning of esophagus from pharynx. Then enterings of the inferior thyroid artery into thyroid gland and middle thyroid vein emerging from thyroid gland. Another one is C6. It is foramen transverse cerium. So vertebral artery passes through this level.
We'll just wait to hear 3 answers. One is beginning of the esophagus, ending of the pharynx. Another one is beginning of the trachea and ending of the
trachea.
Another one is entry of the vertebral artery to the foramen transverse cerium. Right? These 3 answers.
Okay.
Just look for these 3 answers. No problem. You don't have to remember other things. Just wanted to tell me what you are doing. That's the exercise, but they would always try to have these 3 answers. So, is there anything that I have missed to discuss? So, okay. I just wanted to hear another answer. Dr. Bubli, are you there?
Yes, yeah.
Could you tell me at which level carotid artery bifurcates? And definitely, if you do have this cervical spine, you will be asked this question. Just write it down, note it down.
At whose level carotid artery bifurcates?
Okay, no problem. Dr. Sharmin, are you there?
At the superior border of the thyroid cartilage, C4.
Exactly.
Oh.
Upper border of the thyroid cartilage, and people usually use in between.
All bifurcation with the at 4 level.
Exactly.
Cervical 4.
Many of you would like to tell you cervical 3. Just don't go with this answer. Always try to cervical 4. And sometimes you can also use the lower border of the cervical 4, or even if you can also answer cervical 3 and 4. Just don't forget to tell cervical 4, because they just want to hear the cervical 4.
Cervical
If you
4.
are okay
Yes.
with cervical 4, that's okay. If you tell in between cervical 3 and 4, that's also okay. If you also tell the lower border of the cervical, that's also okay. Just don't tell on cervical 3, right?
Yes.
Okay. Okay. Could you tell me how to demonstrate hyoid bone, Dr. Shamin?
Hyoid bone, yes. So first we have to ask the patient to look up in the ceiling. So below the chin, just we will place 2 fingers. So in just below the finger, the prominent bone will be the hyoid bone.
Okay, just 2 fingers, right? So I think we have done with this cervical span, and this is the most least important. You won't definitely find in your exam. I wish you won't, because it's not that much important. But if you are very much, if you want to do very well in your exam, especially in the anatomy, always emphasize, give your efforts on the head neck portion and upper limb and lower limb also. Just I always used to revise head neck portion, upper limb and lower limb in every week, every definite week. And Alhamdulillah, I answered every single questions from anatomy section, and I can assure you that definitely I have achieved more than 52 or 53 out of 60 questions, 60 marks from anatomy
So
section.
Dr. Ifat, do you think the material actually we do have is enough to pass the exam?
Definitely you want all the pictures from your textbook. All the textbook are same, if I am not wrong. I don't know which one you was using right now.
What material,
But every
what material Sharmin is asking,
which
telling about?
which material, Bhaiya?
If I'm sorry to disturb you, when I